Hey, Dave O'Sullivan here. After my 15 plus years working in professional sport, running my own private practice and growing it where I now have a team of go-to therapists and mentoring over 1,000 plus therapists all over the world, I noticed a common problem with patients who weren't progressing. Now, this was significant for both private practice therapists, but also for clinic owners, because with the patients who weren't progressing, this was causing therapists to experience overwhelm, self-doubt, and even imposter syndrome, while it was costing the clinic owner ethical profit because the patients weren't progressing. And most importantly of all, the patient wasn't getting the result that they came to the clinic for help with in the first place. And there was a common theme when I went back and I looked at my own therapists and the patients that weren't progressing and the 1,000 plus therapists we've helped over the last 10 years. And that problem was there was a mismatch in how the patient defined value and their patient defined value outcomes of how they perceived value and the treatment plan and execution of the therapist. Said another way, there was a misalignment between what the therapist was treating and optimizing its treatment for and how the patient defined value. So this is what caused me ultimately to create the Go-To Clinic Hub, where it's a hub that puts the patient-defined value outcomes at the center of everything we do as clinicians. And that's going to help not only the therapist stay focused, but it's going to give the therapist no option but to treat the patient in alignment with how they define value. So if we go into the Go-To Clinic Hub, we'll see here the how-to library. We'll see all of the different body parts. Now, if I go to the lumbar spine, you're going to notice the outcome protocols. And this is the true power of the Go-To Clinic Hub. So if we wanted to help that patient, for example, one of the key things that that patient wanted to be able to do, and one of the outcomes they want to achieve is to be able to sit pain-free for 5-6 hours a day. If I click on that protocol, this gives the therapist all of the clinical reasoning that they need to allow them to maintain their treatment autonomy if they so wish. And it's also going to give them the key skills that are needed and all of the key anatomy. Now, this is powerful for a number of reasons. This in real time allows the therapist, if the patient is stuck trying to achieve this outcome, the therapist can quickly scan this section and figure out the tissues that they may have overlooked and may now want to go and assess or actually treat. Now, in addition to the high-level strategy of having the outcome as the thing we're optimizing for and giving your therapist and yourself the clinical reasoning and all of the anatomy, the biomechanics, and integrating that with pain science that we need, it also gives you all of the assessments that you need to be able to find which tissues we may want to influence. In addition to that, it also gives you all of the hands-on techniques and the early stage rehab techniques to get that fast start to clear that outcome for the patient. So for example, with this patient, if I went back and I went, actually, okay, one of the things that they're struggling with is they can't relax their low back. Okay, we look at the assessments, we find out actually they may need some help relaxing their low back tissues. The iliocostalis hands-on technique, it's right there for your therapist. So the therapist can maintain their treatment autonomy with the high-level strategy, but if they're stuck and if they need additional hands-on techniques or rehab, they have everything they need to achieve the outcome for the patient. So this is going to be powerful for clinic owners because it's going to give you as a clinic owner an opportunity to now hire even new grad physiotherapists or sports therapists and have them outperform more expensive private practice therapists who have got low patient visit averages, they've got low will, and there's an ego where they don't want to keep the patient progressing or hold themselves accountable to achieving the outcomes of the patient. Because private practice is hard to make profit as it is. There are low profit margins and it's very, very difficult to find private practice therapists in this current environment. So with the Go-To Clinic Hub, you now can train your therapist to extract value of how the patient defines value outcomes, and then you can give them everything they need from the clinical reasoning to the assessments, to the hands-on techniques, to the early stage rehab, to the end stage rehab to deliver those value outcomes. And there will be undeniable proof that your patient has received value and that they are keep progressing even when the pain eases to their ultimate definition of success. So the protocols are absolutely critical to make sure that we align our treatment techniques with how our patients actually define value in the real world and they can feel the difference. Now that's one component of the Go-To Clinic Hub. We also have the exercise library where the patient can maintain progress and give them everything that they need based on what they define as their outcomes. Now, what about when you have a complex case? Now, in the past, a complex case meant the clinic owner had to sort that and get involved. Well, what we've done in the Go-To Clinic Hub is we've created a set of tools that allows a therapist to self-reflect. So now we've got a complex case rehab builder that works on the principles of metacognition. Metacognition gets a therapist out of back of mind where they're emotionally dominant, where their limbic system is up, and it gets them into front of mind problem-solving mode. That's essential for clinical reasoning. So they can use the tools in the Go-To Clinic Hub to get everything out of their mind, organize their thoughts, connect the dots, and ultimately solve the problem. So they've got the rehab builder, they've got the high-level planner, and then they also have an after-action report with any cases that didn't go according to plan or any cases that went really well. And that's really important so that the clinician can continue to learn each and every month. So now we have the clinician with certainty that no matter who comes through the door, we can ultimately, whether it's the first session or the last session, anytime that the patient stagnates, we can go and we can check anything that we've overlooked, and we've got everything we need to deliver those outcomes for the patient. We've also given the therapist certainty that no matter what patient comes through the door, they have got support in real time. Now, the next big thing that we have in the Go-To Clinic Hub is we've got an ability for clinicians and therapists to self-manage. So within the Go-To Clinic Hub, we've got the therapist monthly key performance indicators. And that's where you can have yourself or your therapists actually fill in their data, compare it to their clinical standards, and then use our members area to fill those gaps. Because we have a head physio dashboard metrics to mastery course that shows your therapist that if their IA rebook rate is down, what are the key actions that need to happen? What are the key inputs in order to change those outputs, which is the initial assessment rebook percentage. If their patient visit average is low, we can correlate that with what session the patient is dropping off and then quickly fill the gaps in knowledge to gain the skills to improve your therapist patient visit average, but most importantly of all, keep that patient progressing to the final session. So that's another key feature of the Go-To Clinic Hub. We also have clinic owner tools so that you have got everything you need to ultimately help your patient. So when we look down the side here, we've got the clinic owner tools where we've got the operational dashboards, we've got the head physio growth calculators where we can see the difference in improving our therapist numbers, what that's going to do to appointment numbers, but also to the revenue of the clinic. So we can make the most smart decision where we take the emotion out of it. As clinic owners, we get out of back of mind emotional dominance into front of mind problem solving. So we can take all that emotion out of our decision making and work smarter, not harder. So all of the clinic owner tools, from our customer journey dashboards to our time reviews for our staff and ourselves, to our vision documents, to our strategic planning, to financial tools so that you can make better decisions. Everything that is there in the Go-To Clinic Hub for either the therapist working in private practice or the clinic owner. My vision with the Go-To Clinic Hub is to give the therapist working in private practice and the clinic owner everything they need to self-manage. Because I know firsthand how daunting it is in private practice. When you go into private practice, the patients are not presenting like university. They're vague symptoms. Us as clinicians, we've got all of this knowledge, but how do we take all of that knowledge and organize it? And that's what we've built in the Go-To Therapist Mentorship, is a step-by-step system to confidently help any patient who comes through the door. What the Go-To Clinic Hub is now doing is that is giving you a cheat sheet essentially specific to the protocols for how the patient defines value. So all you need as a clinic owner is a clinician who can do a very good subjective assessment, extract how the patient defines value, and the Go-To Clinic Hub will do all of the heavy lifting to give your clinicians the tools, the skills, and the knowledge to deliver those outcomes. We'll even do the heavy lifting in terms of confidently explaining the problem, solution, and plan to the patient with the exercise library. So now you have an opportunity as a private practice therapist to enhance your reputation, to go to work every day feeling certain, no matter who comes through the door, you have got something in real time that allows you to stop you overlooking or missing things. If the patient is stagnating, you can use our high-level strategy to retain your treatment autonomy, and if those treatment techniques aren't working, then you've got access to all of my advanced hands-on and assessment and rehab techniques. So you can achieve clinical excellence in the most simple and direct path. What does that mean for you as the clinic owner? Well, that means now that you can have even new grad therapists outperform private practice therapists who do not align their treatment plans with how patients define value outcomes. The Go-To Clinic Hub is available as part of our therapist mentorship, our clinic mentorship, clinic mastermind, and train my clinician pathways. So if you're a clinician that wants to excel in private practice, or you're a clinic owner that has a team of therapists and you want us to do all of the heavy lifting, you can access the Go-To Clinic Hub as part of your clinic or as part of your practice. There's a button below if you want to know more, if you want to have a demo on how this can help you in your particular situation. Click on the button below, schedule your demo, and we will see which is the right program for you and ultimately give you access to the Go-To Clinic Hub, in addition to a lot of other valuable resources so that you have everything you need to be successful in private practice. If that's you as a therapist, you can go to work, you can enjoy going to work every day. You know that you've got the skills, the tools, the knowledge to help your patients who come through the door. You can switch off at night knowing that you've done a good job for your patients that day, that your patients are progressing, and it doesn't matter who comes through the door tomorrow, you have the confidence and the clarity of where to go next. If you're a clinic owner, it's going to give you peace of mind that your therapists are highly skilled private practice go-to therapists that can protect your clinic's reputation, but most importantly of all, allow you to get freedom. You can now reduce your treatment hours because your clinicians can keep patients progressing. They've got consistent numbers in their diaries. They've got a plan for every session. They know where they're going next with their patients. And then ultimately that gives you freedom to work on the business and look at other growth levers in order to get to the next level. So if you're interested, click on the button below and I'll speak to you soon.